I'm James Morrow. I'm a GP and managing partner here at Granta Medical Practices. An integrated neighbourhood is building a team of people to provide services in a unified and homogeneous way around our population of 44,000 patients that we have here at Granta. The anticipated population is between 30 and 50,000 for most integrated neighbourhoods, and it's about bringing together the people who deliver social services, acute hospital care, primary care, charitable and voluntary sector, community providers, all working together to provide the best possible service for our patients, for the citizens, in a way that means that there's no organisational barriers to doing the right thing at the right time. I think patients are getting a better joined up service now. They've always expected that we share information seamlessly between ourselves and the specialists, and very often they want to know why they have to go to a hospital to get advice and opinion. Now, that advice and those opinions are flowing to the patients in the practice and indeed in their own homes. So it's reducing our ecological footprint, reducing travel, providing better care and informing how we deliver services across the board. For example, our patients are now able to benefit from expert consultant advice informing the care either in their own homes or in the general practice without the mechanism of having to go to a referral and go to hospital. So it's better for the patients, it's better for the system and better for the environment. We're actually allowing information to flow rather than moving people around the system to get good care. I've always been interested in the idea of delivering good services without organisational barriers as a hindrance. And the opportunities arisen now through the new GP contract and the emerging long-term plan for the NHS to allow organisations to blur those boundaries and begin to work in a much more coordinated way. Granta started this journey by merging 4 practices into one. We now have a population of 44,000, and that's enabled us to engage with the other providers on the patch in a meaningful way around a population that's big enough to enable them to engage properly, but still small enough for us to remain local and to know our patients and to understand what it is that they need from the system as a whole. For example, we have now a project running here with CUH where we have a consultant neurologist who comes into the practice. She comes not to do a clinic as such, but actually to come and work as part of the primary care team with a focus on the totality of the care for 44,000 patients, with informal dialogue, discussion, needs assessment and identification between the needs of the population and the current service provision. And working with us and with the Acute Trust, we are actually very much building a new style of service and a new way of delivering care.